lunch.
There you go, Josh. A nice sandwich for your dinner. There you go.
No respite for Josh.
It's not as big as my arm.
And for Geoff...
I'm afraid I don't usually have lunch, so that's why you've got nothing.
Oh, well, bloody hell. It's little wonder you're thin, then.
And despite Josh's best efforts with Geoff's bread-based diet, he's missing his sweet fix.
I still feel really tired. Like, it's just maybe, I don't know, I just need some sugar.
It's no wonder Josh has crashed and burned, because when he does eat, it's sugar all the way.
I would say it's quite possible that I am addicted to sugar. If I don't get my fix, I feel like a zombie.
Josh eats almost 3 times the recommended amount of sugar every day. To help wean him off his candy crutch, Dr. Christian's going to show Josh exactly what goes into his favourite fix and what these sugary sweets are doing to his body.
I'm going to spoon out roughly the amount of sugar that you get through in a week from sweets only. How many of these teaspoons do you think it's going to be?
10.
About 10. 113 teaspoons of sugar.
No way.
29% of Josh's measly daily calories come from sugar alone, over double the 11% guideline.
What else do you think's in sweets?
Gelatine?
I'm making some gelatin over here for you.
Oh, God.
Sorry, it doesn't smell very nice. Gelatin comes from boiled up bits of animals' skin, connective tissue,
God, that's disgusting.
bones, bits of intestine to help stick those yummy jelly sweets all together. How are you feeling now looking at this?
I feel really sick.
And finally, a few last ingredients to give the sweets that enticing, glossy finish.
Lots and lots and lots of oil. And then carnauba wax. Exactly the same stuff that you find in car bonnet polish. So we're going to put a load of that in. And also beeswax. So I'm just going to scrape you some nice beeswax shavings into there. Do you want to give that a good final mix?
I'll tell you what the weird thing is.
What?
I can actually smell the sweets coming from there.
Because that is exactly what they're made out of. Quite horrific, isn't it?
Just a bit.
With Josh suitably disgusted, it's time to get to the heart of the matter.
This actually is a reasonably healthy heart. A bit of fat around the heart is fine, is normal. What's the difference with this one?
It just looks covered in fat.
The problem with very high sugary diets is that actually it increases the levels of blood fat inside you. And that fat is very high risk for developing diseases. So just because you say that you are skinny doesn't mean your organs aren't all enveloped in internal fat, and it doesn't mean that you're not at risk of developing heart disease and diabetes through your diet.
That I expected that because I was young and because I was skinny, I was immune to all the major illnesses, but obviously not. I'm really shocked. I couldn't ever go near one of them again. It's not nice.
Coming up, we meet Laura, a compulsive calorie counter and burner.
When I don't do the exercises that I set myself out to do, I feel guilty about it. I just feel like something bad's going to happen if I don't do it.
Josh can't believe Geoff's never-ending diet.
So this is your 4th meal of the day, and we've still got tea time to go.
And Dr. Christian's back in Evansville, seeing how the Fat City is trying to encourage kids to kick their bad habits.
My favourite food is at this restaurant, and it's called a Happy Meal.
I know what a Happy Meal is, and I know which restaurant that is, too.
Habitual grazer Geoff Milton and sweet-toothed food skipper Josh Bryson are on day 1 of their diet swap. 4 o'clock, and for the first time there's something on the menu for Geoff. So it's a coffee with 3 sugars versus 2 ham sandwiches.
And this is just another snack?
Well, this was, well, basically, yes, if it would be a... yes. Yeah.
So this is your 4th meal of the day? And we've still got tea time to go as well?
Apparently so, yes.
How is that possible? How is that possible that someone can eat so much in one day?
Keep going. You'll be all right.
I can't do it. I actually can't do it. I can't do it.
It didn't seem that much during the day. I dread to think what the next thing, because I honestly can't remember. I just hope we didn't go to the chippy that night, because it'll kill him off.
Geoff actually had a cheesy pizza and salad, which wouldn't have been too bad if he hadn't scoffed such big snacks earlier on. And it versus chicken, burger and fries, Geoff's first solids of the day.
Well, actually, I don't feel very hungry. Oh, yeah, finally eaten, so I do feel a bit better now. I just took away that gnawing hunger, which was sort of irritating me.
And at 9 o'clock, Geoff gets a taste of Josh's sweet tooth. But how's Josh feeling after 5 meals in one day?
I think I've definitely surprised myself today at the amount I've eaten. I haven't had that up and down of when I had my sugar intake. I haven't been up 1 minute and then crashing down, having to top it back up today. So I'm pretty proud of myself.
Josh may be patting himself on the back. But day 1 isn't over yet.
Josh, you awake? I've got a bowl of cornflakes for you.
Are you joking?
No. There you go. It's only a small bowl, it's not on the normal large size, but it's just a bowl of cornflakes.
It's 1 o'clock in the morning. No, I'm just going to get it done with. And I'm hating this.
Too full and too angry to sleep.
I can't stay in bed. I can't stay in bed. I need to go out.
Josh has made it clear how unimpressed he is with Geoff's diet. Day 2 of the diet swap. For breakfast, it's 4 slices of wholemeal toast versus a bag of sweets. And Geoff's turn to bite back.
A full pack of jellied sweets. That's awful.
No,
sweets? Why would anyone want sweets in the morning?
But Josh also has something to say.
I mean, you had 6 meals yesterday. 6 meals. I don't understand how someone could eat that at 1 o'clock in the morning. Wasn't you satisfied from your tea?
It wasn't the satisfied job. It was just, I was watching the telly or whatever it was that night and I had it, you know.
So you didn't need it?
No. Didn't need it. Don't need half the stuff, you know. It's just too much, the volume's too much, the quantities are too much, the frequency's too much. Hands up. And I can see that now from the way I've been throwing food at you for the last 2 days.
What's it like to eat sweets at this time in the morning?
Are you meant to have energy? Because I just feel...
Do you?
I feel less energetic now than when it started.
I feel really embarrassed.
Seeing each other struggle has made both Supersize and Superskinny realise they need to change. But for the 1.6 million people in the UK living with an eating disorder, change can seem impossible. We've been following 6 people who hope by sharing their own personal stories, they'll inspire others to seek help. Laura is a 22-year-old fashion student addicted to exercise.
My current exercise routine is one that I've made myself. It basically involves arm exercises, sit-ups, kind of crunches and leg exercises as well. I also go to the gym and I'll just run for a long time and then I'll use the weights as well. When I don't do the exercises that I set myself out to do, I feel guilty about it. I just feel like something bad's going to happen if I don't do it.
Exercising obsessively is a common symptom with eating disorders. It's seen as a compensatory way of burning off calories. The need to exercise can become compulsive, taking over one's life.
She's quite secretive with her exercising, but we didn't notice it probably for a couple of years. Now you can really see it. It's really quite obsessive.
Exercise isn't Laura's only obsession. She consumes a measly 600 calories a day. That's 1,400 less than the recommended daily amount for women, and well under the amount her body needs for the exercise she does. This has been going on for 5 years.
Things weren't going the way I thought they were going to be. I went and just got a really monotonous job, so me and another girl that I was working with started trying out like fad diets, like drinking protein shakes, eating a blueberry every 15 minutes. I went back to college after that. By that time, I was totally consumed by it.
Laura's diet is mainly a mix of cereal with water and energy drinks. In combination with her extreme exercising, this has had a severe effect on her body.
I'm always cold, I'm always tired. I've got a thyroid problem now, so I'm on medication now for that, potentially for the rest of my life.
When Laura hit 7 stone and her hair began to thin and fall out, she got professional help.
After I went to see my GP, I was referred on to a psychiatric nurse for CBT, which is cognitive behavioural therapy, and it's basically just to address what would maybe trigger you to feel upset or anxious about what you're going to eat.
I'm proud of her for like what